What should you expect 1 week after your carpal tunnel surgery? If you're navigating through this early stage, you might have questions swirling around in your head about what's normal, what's not, and what tips can help you stay on the right track. Well, I hope to ease your concerns and answer your questions because we are going to be talking about topics such as dressings and incision care, pain and swelling, movement and function, and understanding your limits 1 week after carpal tunnel surgery. Really quick, if you haven't had surgery yet, but you want to better prepare yourself, then check out my video, How to Prepare for Your Upcoming Carpal Tunnel Surgery, here. Now, keep in mind, you should always follow your doctor's post-operative instructions. And remember, every person is different in how they heal, plus every surgery and surgeon is different too. First up, let's talk about dressings and incision care. Now, as your incision heals, it's necessary to maintain a clean environment for your incision to prevent infection. Since you had carpal tunnel surgery, you either had it done endoscopically or had an open release. If you had an endoscopic release, you still likely have one long stitch or two smaller stitches right at the top of your wrist. But if you had an open carpal tunnel release, you likely have several smaller stitches at the base of your palm. Now, some of you may still have a very large surgical dressing on your hand, so you may not even know what your incision even looks like at this point. While some of you may have been instructed to remove your dressings after just a few days. Or maybe you went to therapy and a hand therapist actually removed them for you. Unfortunately, what you are allowed to do at this point varies greatly. If you're in the first group and you still have your surgical dressing on, then there's really not much that you can do at this point, except to wait. More than likely, you have an appointment very soon to get your dressings removed. But if you're having a lot of incision pain and you're really struggling with having your dressings on, then you may want to give your doctor's office a call. Since you're a week out, they may let you actually remove your dressings at this point, or at least come in for an earlier appointment. Now, for those of you transition to minimal dressings, you actually get to care for your incisions and stitches. Now, those typically are removed around 8 to 10 days, give or take. Keep in mind, it can be longer for diabetics, but also if your incision is not healing. Even though stitch removal is right around the corner, it's important to continue keeping your incision clean and dry. The general rule for incision care is to avoid applying a lot of soaps, lotions, ointments, at least in my experience. And some doctors will allow a very thin layer of Vaseline to prevent your incision from drying out. But some will not want you to apply anything. And others want you to use neosporins or polysporins. But in my experience, applying too much of anything can actually cause irritation or incision maceration, which basically means your incision gets too moist. The best environment for your incision is to heal. So it's really a balance of not too dry, but not too moist. Either way, 1 week after your surgery, your incision is still healing. So avoid creams and anything with a fragrance, also cleaning with alcohol, and also avoid soaking your hand underwater for longer periods of time. Covering your incision is still a good idea though, especially if you're going out. And for that, a larger Band-Aid or a Tegaderm film can do the job. Even a small compression sleeve of your hand can often be a nice additional barrier to dirt and germs. Now let's talk about pain and swelling 1 week after surgery. By now, your pain and your swelling has likely improved a lot compared to right after surgery. In my experience, most people at this point do not have a lot of pain, but describe more of an achy feeling. Usually it's located around the thenar muscles of the thumb. And typically wrist movements usually cause a little more discomfort, especially if you had the endoscopic release done because you're pulling on that incision at your wrist. But if you had the open carpal tunnel release, you usually feel a little bit more discomfort moving your thumb around due to the pulling of the incision at the base of your thumb. Keep in mind, everybody has their own unique tolerance to pain, but in general, carpal tunnel surgery tends to cause just mild achiness and discomfort at this point. Extreme postoperative pain is less common unless you have developed a complication such as maybe an infection or if you had additional procedures done. Either way, it's very important to communicate with your surgeon, especially if you are having really high levels of pain that's preventing you from sleeping or wanting to move your fingers. Since your pain is typically minimal 1 week after carpal tunnel surgery, then more than likely your swelling is minimal too. Now, that doesn't necessarily mean you can wear a watch or maybe put on a ring yet, but the swelling in your fingers and hand should be mild. And it's pretty normal at this point to notice some fluctuations in your hand swelling that can be triggered by certain activities like overusing your hand or enjoying too much salty popcorn the night before. But rest assured, it's pretty normal to notice some kind of swelling for a couple weeks and sometimes even a couple of months. Now, on the flip side, excessive swelling or severe swelling, especially if it's accompanied with redness and pain, is not common at 1 week after surgery. So this could be a sign of infection, and again, this should be brought to your doctor's attention right away. Basically, a little discomfort and mild swelling is still expected. It's only been a week. Actually, moving and using your hand for light activities can actually help your pain and swelling at this point. And so that brings me to talk about exercise and function. This is where your focus should be 1 week after carpal tunnel surgery. Ideally, your finger and thumb range of motion and your wrist range of motion should be normal or at least functional. At this point, you should be able to make a gentle fist, move your thumb to the tip of each finger, as well as bend your wrist back and forth. You may not be able to squeeze into a tight fist or move your thumb like all the way across your palm without discomfort, but just know that the sooner you can recover your normal motion, the quicker you'll be able to get to be able to do most of your daily activities. So you should be able to pick up a cup or carry your phone, maybe do a little typing, but you may not have the endurance to do all of that for too long. And it's not uncommon for your fingers to feel weak or even slightly numb because your nerve is still healing. So make sure you're doing finger, thumb, and wrist active range of motion exercises a few times a day because that can help you get your endurance back faster. If you're looking for carpal tunnel specific exercises you can do, then check out my video here. And that brings me to function. As I mentioned, you'll likely have normal or close to normal range of motion, so there will be a lot of light activities you will be able to do, like probably folding laundry, getting dressed, feeding yourself. But stay out of dirty dishwater since you still have your stitches in. As you start using your hand more, you'll likely notice you have no strength or endurance. And that's totally normal right now. Even though you may be able to hold light things, you may not be able to open a bottle or a jar, or hold a blow dryer too long, or open a sticky lid of toothpaste. That may feel impossible to do at this point. And that's because of decreased finger and thumb strength, but also because your sensation hasn't returned all the way. And you may notice that your hand gets really tired and achy if you try to do too much for too long. So you may not be able to spend a lot of time on food preparation and cooking because by the time you go to try to feed yourself, your hand may just feel exhausted. The good news is this will improve over these next few weeks as you use your hand more and more, and as you continue to heal. At this stage, it's okay to ask for help from others, or if you don't have anyone, then using a gadget such as an electric can opener or having a few meals delivered to you can be a huge help. Plus, it will prevent you from overstraining your hand. Activities you should just not even try at this point yet, if you can help it, are strenuous activities like shoveling or using tools that vibrate, any kind of heavy lifting or anything that requires you to put a lot of pressure into your palm, even activities that require you to overstretch that nerve as you're healing. So you'll likely have to wait to get back to doing yoga and push-ups, and it's really not the time to start any home renovation projects right now. Now, if you have more specific questions or you're unsure of what you can or can't do, again, always ask your doctor. And finally, let's talk about understanding your limits 1 week after carpal tunnel surgery. Now, I usually find at this stage of recovery, there are two types of people. The first group feels great. They have minimal to no pain and do more than they should. I get it. You can finally sleep at night. You have no numbness and tingling, and you can use your hand normally. But if you fall into this category, patience is key. Despite the temptation to dive back into normal life, you can easily overdo it and set yourself backwards by causing more pain, swelling, and maybe even more scarring in your hand. So continue to protect your incision, avoid heavy lifting or gripping at this point. Now on the flip side, the second group tends to be a little more cautious, maybe even afraid to move your hand due to pain or fear of undoing something inside your hand and ruining the surgery. Now, if you fall into that category, your joints can stiffen up quickly, causing pain, and your tendons that cross that carpal tunnel could be in the early stages of scarring down. A carpal tunnel release is just that. It's a release. It's not a repair. Sure, they repair your skin to close the incision, but there's nothing inside your hand that you can undo unless your doctor specifically advised you not to move. And in that case, you would probably be in some huge splint or cast. So I encourage you to work on your hand and wrist motion and ask your doctor or hand therapist for some gentle exercises. You'll feel better and it will actually help with decreasing your pain and your swelling. Plus, it'll get you closer to using your hand for the activities that you love to do. As you continue to navigate through your carpal tunnel surgery recovery, remember to follow your surgeon's instructions diligently. Continue to keep your incision clean and you will be stitch-free very soon. And don't forget to make sure you are rehabbing yourself with active finger, thumb, and wrist exercises, but also doing light daily activities. And remember to listen to your body. When your hand gets tired, stop what you are doing and rest. Healing really does take time. Now, if you found this video helpful, do please give it a like and hit that subscribe button below. If you're interested in those carpal tunnel exercises I was talking about earlier, then check out this video here. Until next time, thanks for watching.